So in this video, I will be showing you how I would do an abdominal assessment on a patient. However, I don't have anyone to practice on, so I will be using a pillow. So for the sake of this video, I will be talking you through how I would do my assessment on someone, and I will share most of the questions I would ask, and I will demonstrate in the end of this video. So when I walk into a room, I would sanitize my hands, I would introduce myself, I would say, "Hi, my name is Juliana, and I will be your student nurse today. Today I was asked to come in and perform an abdominal assessment." So what that means is I will be using my stethoscope to listen to any sounds in your abdominal area. I will also be assessing for the shape, the symmetry, if there's any distension, and I will be assessing the skin, just making sure everything's all right. Is that okay with you? And if they said yes, I would go ahead. I would ask them if there's any history of abdominal pain, if they've had a bowel movement or when their last bowel movement was, and if they knew the consistency, if it was constipation or diarrhea, or if there was any abnormal color. If it was a female, I would ask when their last menstrual period was. If it was a male, I would ask if they had any trouble trying to start a stream or had any pain while peeing, as this could lead to prostate enlargement. And I would ask if they've had any previous problems or treatments for anything in the abdominal area or any changes in appetite. So for this part of the video, I've already led you through my hand washing, my introduction to the patient, what questions I would ask them. So this is solely the physical aspect where I'll be doing my inspections, my auscultations, and my palpitations. So when I'm inspecting, I would look for any symmetry, any distension. I would look at the skin quality, and I would look at the umbilicus, at the belly button. And from there, I would start my auscultations. If everything appeared to be normal, I would start my auscultations in the lower right corner. I will move to the upper right quadrant. I would move to the upper left quadrant. And I would move down to the lower left quadrant. And I will hold it there for 10 seconds each, listening to the sounds. So when I was listening, typically bowel sounds are high-pitched gurgling sounds, and if there was any whooshing, that could indicate a bruit, which in that sense I would avoid palpitation. And now when I'm palpating, I will lightly palpate to feel for any tenderness or any pain. I will repeat the same pattern, starting in the lower right quadrant, moving to the upper right, moving to the upper left, and then moving to the lower left quadrant. So I will start lightly, ask if there's any pain, any tenderness. No. And then from there, I would palpate deeply to start feeling around for any masses or any abnormalities. And then once I was done that, I would ask the patient to replace their clothes. I would wash my hands once again, and then I would be done.